Greetings, Eric Brown, MOBO-Media. Hey, I thought I may report on something that's really going on right now that people are really watching, and that's the spread of what's called Legionnaires disease. Legionnaires disease. You know, in New York right now, New York's being hit right now for what they call clusters, which is a group of folks being hit at one time by some mysterious diseases. So they've deemed it Legionnaires disease. I think about 58 people were infected. So far, 2 people have died. That may be old information because I think this thing is getting pretty rampant. And it started with really cooling systems they have in New York and some of the buildings there. If you don't understand cooling systems really take the air that's already there, and they'll either heat it up or cool it down or whatever. When you talk about cooling buildings and things like that. But sometimes when you have air that's not cool enough just sitting in these cooling systems, it becomes stagnant. And so what that does, it breeds, this bacteria called Legionella, something like that, man. It's some nasty stuff, man. And, right now, health officials and people really around the world are watching this because I think it's not just happening in New York, it's happening in other hotspots around the world. But it's, I've heard of Legionnaire's disease. I just never really knew of anyone with it or knew anything about it. So I really had to do my own homework to figure out what it was. But it's some nasty stuff, and once again, it's a respiratory illness, pretty much. It's pretty much from everything I've read, it's a respiratory illness, but it could definitely cause havoc on the rest of your organs in your body and things like that. So I got some notes here I'm gonna go off of. I'm gonna kind of talk about a little bit of what I've researched on it, real quick, because I mean it's the news is spreading like wildfire. I just want to get in front of it and find out really what's going on and who's at risk. And so, like I said, it's in New York right now. They've got some cooling systems in some buildings up there that they think that's where the Legionella disease came from. It starts from that stagnant air sitting in those cooling systems that actually are pushing air conditioning to the buildings, and so people are breathing this stuff, and so that's how they get the illness, the sickness, Legionnaire's disease. And so they breathe in pretty much water droplets. This thing really breathes in like water and dirt. It sounds pretty basic. I mean, that's water and dirt is what it thrives in. And so, as you can imagine, a building like that with stagnant water is definitely going to thrive and affect quite a few folks. So right now, what they're trying to do, they're trying to get a hold of anybody that may have been in that building, have been within the vicinity of those cooling systems, to see really how many folks are infected, because this stuff can kill you. It can definitely kill you. And by all accounts, it has the same symptoms as bad flu, something like that. But it's considered a bad form of pneumonia. It's considered a very bad form of pneumonia. And like I said, it's spread through contaminated water droplets out of cooling systems, hot tubs, fountains, large water systems. Any place that you have water, especially in a public place, man, I'd be very careful of right now, because all it takes is a couple of those water droplets to get inside your lungs, and you're done for it. Because the crazy thing about this Legionnaire's disease is that the symptoms don't all come at once, obviously. They'll come slowly, so you might chalk it off as a cold or a flu or whatever. Next thing you know, this thing is progressing, so that's why you want to get on top of it, or at least be on the forefront of knowing what is out there right now in terms of respiratory illnesses and the flu season, everything else, man. Because I tell you right now, man, after 2020, there's been so many things that have been out there, man, it's ridiculous. I've lost count. But Legionnaire's disease is the next thing right now that's really, getting people kind of spun up. Typically, about 6,000 people a year get Legionnaire's disease. About 6,000 people a year. And that's just in the U.S. And so I'm not sure what the worldwide numbers are. If you get the disease, if you get Legionnaire's disease, 10% of the folks that get it, they'll die. So that's a pretty high risk factor for mortality rates or something like that. And as you can imagine, with a population as large as New York, just a few percentages, man, that's a lot of people, man, in the populated area. So don't let that low number fool you. Don't let it fool you. Like I said, the recent outbreaks have been linked to the contaminated water systems in these public and I guess private buildings too, because you have people that lease out these spaces. And so the ventilation system does not discriminate. It just goes throughout the building. And it's carrying that Legionella disease and those water droplets, and people are breathing that stuff in. And it could be somebody just visiting the building or something like that. Could be the damn Uber driver or the damn pizza delivery driver. Just all of a sudden he's in there, and next thing you know, he's having symptoms days and weeks later, not even realizing it was because he just went into that building and just breathed. All he did was breathe air, basically, went to that building. So some of the symptoms really will start to appear between 2 to 10 days after you're exposed to Legionnaire's disease. About 2 to 10 days is when you can expect the symptoms to appear. Now, you can expect everything from a headache, obviously the muscle aches, fever, chest, cough, congestion, shortness of breath, confusion. It all sounds like just a horrible, horrible flu, a bad cocktail of flu and everything else in between is what it sounds like. And so, sounds like to me, and that's at the full-blown stage. That's when it's really off the charts. But there is a milder version of it. It's called Pontiac fever. And this mild version, it causes flu-like symptoms, but it doesn't have the lung infection. So that's a good thing, because oftentimes the lung infections are what healthcare professionals are concerned with, because you start getting infection in your lung. Now it's a race against time, but depending on how aggressive that infection is, especially with pneumonia, it could be pretty rough, and so you got to want to get on top of it. Now there are groups of people that are at higher risk for Legionnaire's disease. Obviously within population there are people that they've identified within the population that these folks probably will have a more than likelihood of getting it. And those are older adults, you know what I'm saying? Obviously, as we age, our respiratory system weakens, immune system weakens. Smokers, like I said, people with weak immune systems, they're at risk. Or chronic illnesses like lung disease, like COPD, those lung diseases. There's a lot of lung diseases out there right now. I tell you, after 2020, man, I tell you, I don't know. I don't know what happened with the healthcare industry or the community, but there's been just a lot of stuff out there that no one's been able to explain it. But also, diabetes is another a high risk group of folks that have a high likelihood of getting Legionnaire's disease. If you have diabetes or kidney disease. So if you think about it, it's really the immune system is what this thing is focused on. And that's what it attacks, the immune system. So it'll cause organ shutdowns and things like that. You end up on kidney dialysis because you got Legionnaire's disease, And if it's untreated, it can lead to lung failure. Especially when it's full-blown, because remember full-blown is when it's respiratory. It's in your lungs and stuff. And that's what's going on in New York right now, because that's respiratory, those water droplets. It can cause septic shock. Septic shock is a bad thing, because septic shock is like, it can hit you so hard, man, that the doctors, all they can do is try to fight as best they can with antibiotics and some of the other little cocktails they have, man. But septic shock is a serious thing. Acute kidney failure. So it can cause kidney failure. So if you already have issues with kidney failure, this is very important to be mindful of what Legionnaire's disease can do to you if untreated. It can just destroy the rest of what remaining kidneys you have. And so you want to make sure that you get on top of that. And it's all potentially fatal. All this stuff I just talked about, the lung stuff, septic shock, the kidney failure, it's all potentially fatal. You can die from these things. I'm not just listing these out just because it's, you could or could not, yada, yada, yada. People have died because of these reasons. That's where this data comes from. It comes from death. Now, unfortunately, lessons are learned in the hardest ways, and, it was learned through death. And that's why we have information like this, like that I'm proud of or happy to be able to share with the community at large. You may not be aware. Some are prevention and action. Some of the things you could do to help prevent exposure to it, obviously maintain safe water systems, in the buildings. That's going to be on the building manager or whoever has the overall responsibility for the building maintenance. I'm not sure how this is going to work out in your situation. Just figure out who has the authority over the air coming through those ventilation systems, and if they're inspecting those things. And you should be able to request copies of it, because in the U.S., man, open records are huge things. Open records are huge things, especially when it comes to things that are affecting your health or affecting your well-being. So I would definitely look into that to make sure the folks are maintaining safe water systems, and not only that they're maintaining them, but they're documenting that they're maintaining them. But seek medical attention immediately if the symptoms start to appear after you have some possible exposure. Just like the folks in New York, if you've been in those buildings that have been identified in the news outlets that had those water coolers in them, then you might want to get checked out if you start having some symptoms and things like that. I don't know if there's, what test is there for Legionnaire's disease? I know there's some blood tests they look at, but the best thing is time. When you start to get these symptoms, you know you've been exposed at places like that, time is not on your side, so the clock is ticking, so you need to seek immediate attention. And early antibiotics save lives. Early antibiotics save lives. That's what the doctors typically will be doing. They're going to be pushing a lot of antibiotics to you, some probably heavy doses of antibiotics, so prepare yourselves. You may want to prepare your diet, because I know with me, a lot of antibiotics, I don't take a lot of medication, but any times that I've had to, antibiotics, man, they can do some things to you, man. They can tear your stomach up. They can cause stomach issues. Antibiotics can give me headaches, especially the strong doses, man. And antibiotics can also cause, some of them, I know for a fact, can cause weight gain. And that's another thing to be mindful of. If you're already on a weight program, things like that, be mindful that it can cause weight gain. With that, this is Eric Brown, MOBO-Media. I thought I'd give some news on Legionnaire's disease and the reason why we need to pay attention to kind of what's going on, because it is in the news. It's a pretty trending topic right now, so I would ask everybody to be mindful of your symptoms and be mindful of the locations you have visited. With that, this is Eric Brown, MOBO-Media. I am out. Y'all take care. Bye-bye.